after a press release from the Joint Information Center 2 days ago identified a man residing along Swamp Road as the second patient to have contracted dengue fever. Linda DeNorsi, the director of the Department of Public Health and Social Services, says that 2 more potential cases are currently being screened for the disease. During a press conference with several government officials yesterday, DeNorsi says that there was no connection between the first 2 cases and that 18 homes along Swamp Road have been identified to be in the high-risk area, and that the agency is working with the Didido Mayor's office to eliminate illegal dumping sites which can act as breeding grounds for mosquitoes. While the initial assessment of the high-risk area in Manilao, the location of the first dengue infection, identified 82 homes within the designated 200-meter radius, DeNorsi says that the number has since increased to 90 due to some of the residents having extended households. Public Health established that the high-risk areas would consist of a 200-meter radius based on the flight distance of the mosquito, which ranges from 150 to 200 meters. In addition, teams dispatched by Public Health to capture and test mosquitoes have found the results to be negative for the disease. To increase early detection rates of potential dengue cases, Governor Lou Leon Guerrero says that Public Health is working on the issue.
I want people to know that Public Health is also sending out trainers to talk to clinicians in the private sector, private clinics, because we want them to also to be able to catch these symptoms and test for it.
In regards to preventative methods such as a vaccine, Dr. Thane Hancock, an epidemiologist from the Centers for Disease Control, says that such a product does exist, but is still being evaluated for whether or not it is a safe option.
The WHO recommendations say that it should be used in places where there's a high level of endemic dengue, so that there's a lot of transmission of dengue, because they find that if you haven't had dengue and you get the vaccine, there can be issues. So that's why the dengue vaccine is not available in Guam, and also would not be helpful for Guam.
While applying insect repellent and wearing long-sleeve clothing is recommended to decrease the risk of infection, DeNorsi encourages the public to remain active in preventing the spread of the disease.
The key here is to do prevention through eliminating all these breeding sites for these mosquitoes. And that is the message we're trying to get out there. And if you feel sick, please see your provider. Informing the providers, please, if their patient is ill and has all the symptoms of dengue, have them tested.
Amanda Dedicatoria, PNC News.